Hello everyone, my name is Naz. I'm sorry I'm sending this late. I will be talking about Ebola virus and the role of APN. Introduction to Ebola virus. I will be discussing a critical topic in global and public health, Ebola virus disease, commonly known as Ebola. Although this disease is not new, recent outbreaks have highlighted the rapid spread of infection disease and underscore the crucial importance of healthcare preparedness. Today's presentation will provide a clear and hopefully informative overview of the Ebola virus disease, including its causes, symptoms, treatment, and prevention. I will also emphasize the vital role of advanced practice nurse in responding to and managing such as Ebola, APN's frontline clinicians, educators, and advocates who can significantly influence the outcomes of infectious disease crisis. Ebola virus is a severe and often deadly illness caused by a group of viruses known as ortho-Ebola viruses, formerly Ebola virus, which belongs to the Floribrae family. It was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Transmission primarily happens through direct contact with the blood secretions, organs, or other bodily fluids of infected people or animals. The disease is not airborne, which is an important point when discussing infection control. Ebola has a highly variable mortality rate, ranging from 25 to 90%, depending on the strain and the timelines of medical intervention. The virus has caused multiple outbreaks in sub-Saharan Africa, and its highly infectious nature makes it a global health threat. So one fact is, CDC reported that the last confirmed case on January 30, 2025 in Uganda, and Ugandan health officials reported a confirmed case of Ebola. It's one of the viruses like Sudan virus in a patient who died at National Referral Hospital in capital of Kampala. This is just the overview of Ebola virus disease in the world. As you can see, it's mainly in South Africa. Signs and symptoms of Ebola disease may appear 2 to 21 days after contact with the virus. On average, people begin showing symptoms 8 to 10 days after exposure. Initially, symptoms are non-specific and referred to as dry symptoms, which can be deceptive at first because the early symptoms like fever, fatigue, headache, sore throat, or muscle pain, which resembles of many other infectious diseases like cold and flu. As the disease progresses, it can result in more severe signs, also known as wet signs, including vomiting, diarrhea, rash, impaired kidney and liver function, which is very dangerous. In many cases, patients experience both internal and external bleeding, such as bleeding from the gums or in the stool. Early recognition is essential not only for patient care, but also for public safety and containment efforts. Another fact, patients who passes away from Ebola disease are usually develop more severe symptoms early in the illness. Patients who survive may have fever for several days and begin improving about 6 days after symptoms started. Diagnosis and treatment. Accurate and early diagnosis of Ebola virus is crucial. The most common methods include RT-PCR, which detects the viral RNA, and ELISA, which measures the antibodies. Unfortunately, there is no antiviral cure for Ebola yet. Treatment focuses on supportive care or the symptom management, maintaining hydration, electrolyte balance, managing co-oxygenation and blood pressure, and treating any other co-infections that may happen. Promising therapies like monoclonal antibodies, such as Imazep, have shown to reduce mortality in clinical trials. Additionally, the Ervoba vaccine, which is effective against the Zaire strain of the virus, has been approved and is been using for the outbreak-prone areas, such as South Africa. Even though these developments are encouraging, accessibility and rapid deployment remain significant challenges. Prevention and control. Prevention of Ebola transmission relies heavily on strict infection control measures. For healthcare workers, personal protective equipment like PPE is essential, including gloves, gowns, face shields, and respirators during high-risk procedures. Another key strategy is prompt isolation of suspected or confirmed cases to prevent community spread. Raising awareness of risk factors and protective measures that individuals can take is an effective way to reduce the transmission of human disease. Contact tracing, quarantining exposed individuals, and community educations are also pillars of outbreak control. On a larger scale, vaccination campaigns in high-risk populations have become a vital tool. In short, prevention requires a coordinated effort between healthcare systems, government agencies, and absolutely the public. APN role in case of an EVD response, which is Ebola response. Advanced nurses, practice nurses are uniquely qualified to respond to a public health crisis such as Ebola. Their role spans clinical practice, education, research, and leadership. In the context of EVD, APNs contribute to early detection and reporting through assessment and history taken. They assist in triage, ensuring critically ill patients receive priority care. They also serve as clinical leaders, coordinating with infection control teams, providing direct patient care, and educating staff on proper protocols. Outside the hospital, APNs engage in community education, debunk myths, and encourage behaviors that reduces the transmission disease. Their holistic training enables them to respond comprehensively and compassionately in time of crisis. APN in clinical management. In a clinical settings, APNs are hands-on managing patient care. This includes performing physical exams, monitoring for symptoms progression, and ordering and interpreting diagnostic tests. They are instrumental in initiating a fluid electrolyte therapy, managing fever and pain, and addressing complications like coagulopathy or organ failure. Because they can work autonomously in many settings, APNs often assume a leadership role in care coordination, particularly facilities that are overwhelmed and resource limited. Moreover, they may provide psychological support to patients and families, which is often overlooked but essential in managing life-threatening conditions like Ebola or any other health public crisis. This level of direct involvement helps ensure continuity and equality of care, even in the most challenging circumstances. APN in global health and policy. Beyond the bedside, APNs are increasingly involved in global health initiatives. They may participate in medical missions, advise on public health strategies, or work with international agencies such as World Health Organizations or CDCs. They contribute to disaster preparedness, helping healthcare systems develop protocols and stockpile necessary equipment in outbreak regions. APNs assist in assessing needs, gathering epidemiology data, training local healthcare workers. They can also influence policy development, particularly in areas such as infection control standards, vaccination efforts, and the protection of healthcare workers. Their clinical expertise and systems thinking make them ideal advocates and strategists in the global fight against Ebola and similar threats. Challenges for APNs in Ebola response. Despite the critical role, APNs face many challenges when responding to Ebola outbreaks. First and foremost, as the risk of exposure. Even with PPE, healthcare workers are among the most vulnerable. Additionally, resource limitations such as lack of IV fluid, isolation wards, or vaccination can hinder care delivery and cause morale distress. Another challenge is public mistrust or misinformation. APN must often combat fear, fight stigma, cultural beliefs that interfere with their treatment and reporting. Lastly, working in high-pressure environments over extended periods can lead to emotional exhaustion and burnout. Supporting APNs through training, resources, and mental health care is vital, maintaining a resilient and effective workforce. In conclusion, Ebola virus disease (EVD) is highly infectious and deadly illness that possesses significant public health challenges. While science has made significant strides in understanding and controlling the disease, outbreaks remain a global concern. APN are essentials in this fight. They offer clinical expertise, community education, leadership, and advocacy at every level of response. Their ability to deliver care, build trust, and contribute to policy makes them cornerstone in managing emerging infectious disease. As we prepare for future outbreaks, hopefully not, we're not going to have any time soon, but investing in the education and training and supporting of APNs is not just beneficial, it is crucial to the global health security. And thank you for your attention. Again, I'm sorry I was late about this. But hopefully you enjoyed listening to me. And this is my reference page, which concludes my presentation.